A very good morning to everyone present here. We have gathered here on the eve of World Cancer Day. Today, we are going to discuss the recent trends in cancer, cancer diagnostics, cancer therapy, and how the latest cancer therapy like immunotherapy is coming up to treat the cancer. So, I am Dr. Dhruv, Associate Professor and Cancer Biologist at Amity Institute of Molecular Medicine and Stem Cell Research at Amity University, Uttar Pradesh, Noida. I will be moderating this panel discussion. As you all know, cancer is growing drastically, and every day you might have seen, everyone is associated directly or indirectly with the cancer patients. And if you see, the cancer is the topmost cause of death of human, followed by heart disease. And if you see the world cancer statistics, 18.1 million new cases and 9.6 million deaths reported in 2018. And if you see the Indian cancer statistics data, every year the estimated number of people living with cancer is around 2.25 million. And every year new cases are coming up. It's a 12 lakh Indian population. It's getting reported with the cancer. Out of that, 8 lakh people are dying every year. It's a huge number, and it's growing every day. Today, I have with me here cancer expert Dr. Bhudev Das, Dr. Mausami Suryavanshi, Dr. Subrajit Biswas, Dr. Manoj Garg, and Dr. Pallavi Agarwal. I welcome you all in this interactive panel discussion on cancer. Dr. Bhudev Das is the Dean of Health and Allied Sciences and Chairman of Amity Institute of Molecular Medicine and Stem Cell Research at Amity University, Uttar Pradesh, Noida. Dr. Das has more than 40 years of research experience in cancer. He has worked on several cancers, including oral cancer, breast cancer, and cervix cancer. He is also known as a father of human papilloma viruses, HPV, in India. HPV is a main cause for cervical cancer. Dr. Das is a founder director of National Institute of Cancer Prevention and Research, Noida, and ex-director of Dr. B.R. Ambedkar Center for Biomedical Research, University of Delhi. He has worked for several years with Nobel laureate Dr. Harald Gerhusson at German Cancer Research Institute. He has published more than 250 research articles in top cancer research journals, including Lancet Oncology, Clinical Cancer Research, Nature, and Cancer Research, and many more. So now I request Dr. Das to shed some lights on why we have higher cancer incidence and what are the reasons of failure of cancer prevention and therapy in India. So, Dr. Das.
Well, good morning everybody, and thanks to the Dr. Dhruv for asking these questions. It's a burning questions, and the disease is a dreaded disease, cancer. But if you look at in Indian scenario, and as World Health Organization has estimated that next 20 years the cancer burden will be double in this country. In India, it will be around 22 to 25 lakhs, and this is because some of the cancer, and it is also predicted that soon it will be a cancer capital of the world. It is because of the fact every 3 minutes, one death, every 3 deaths, every minute there is a 3 deaths, and out of 4 deaths in the world, there is a 1 death is of cancer. So, you can see all other diseases, and then cancer is 1/4. And from these points, you can understand that what is the extent of this problem, and it has already been mentioned that this cancer is the death rate is much more than the cardiovascular and diabetes and other diseases which has already been earlier thought of. But now cancer has become a major disease or major killer disease. But the question is why it is increasing in India. If you look at that, some cancers which are highly prevalent in US and Europe, now it is very high in India. So, that how it has changed within 1 decade or a half, like breast cancer and colon cancer, prostate cancer, pancreatic cancer. These cancers were very rare earlier in a decade or 2 decades earlier, but within a decade it has drastically, the prevalence has increased or incidence has increased. But why? That must have changed something. Also one should look that the breast cancer is increasing, cervical cancer or the cancer in women, genital organ cancer was the topmost cancer among women, but it has reduced, whereas breast cancer has increased. But then it is also to be important to notice that breast cancer in our village side and the countryside is still lower prevalence, whereas in the cities, all the metropolitan cities, breast cancer is high. That means something is going changed, and this is because that the lifestyle has changed. We have adapted to the American or the European pattern of the lifestyle. During this 1.5 decade, lot of change has occurred. The sexual life, the regular, the daily life, the lifestyle, eating habits, and the sedentary life, and there and lot of people the smoking habits and use of oral contraceptives, and that contributes to both cervical and breast cancer. So, these are in the rise, and the indiscriminate pollution, indiscriminate contamination and adulterations of what we use every day from morning to evening, what we eat, what we breathe, everything is, you can say, contaminated, and these contaminations contains the carcinogen or the cancer causing agents or chemicals, and including radiations and all other pollution, dust and all. These things lead to the genetic alterations, and this you know that the cancer is a old age disease, because this contamination or the chemical contents our body is exposed, including the women. The cancer causes the breast cancer, the plasticizer, all the cosmetics, they are also cancer causing agents are present there, and because of that it accumulates as you age or as you become older, because cancer happens only after 50, 45, besides some childhood cancers, mostly it is in the elderly ages, and these agents are exposed and you get accumulated all these alterations. And it is not that all will get smoking because of cancer, but someone, because of your individual susceptibility or individual capacity, you develop a alteration or mutation or changes in your genome, and that makes the cancerous growth, and that leads to the cancer development, and
Dr.
this is
Das,
because of this.
As you have rightly mentioned that in 10 years, in coming 10 years, we will have a double the number of cancers. As WHO, World Health Organization has also predicted that by 2030, every alternate individual will suffer from one or other form of cancers globally. If you see the Indian cancer scenario, the most common cancer in men in India is oral cancer, and in women is the breast cancer, and cervical cancer now is coming up in a big way. Dr. Das, could you please tell us the main reasons why is the higher incidence rate of oral cancer and breast cancer, specifically in India?
Yes, this is in continuation my earlier comments that these are the three major cancers, like this oral cancer and cervical cancer and breast cancer. Very intriguingly or interestingly, 10 years before, cervical cancer is the number 1 cancer and the breast cancer was the number 2. But now at this moment, the breast cancer is the number 1 in women, cervix cancer is number 2 or 3 and third level, because that is because of the precautions, and people are aware of the factors that cause or that predisposes these Indian women to this cancer. That is one of the important reasons. That is my research field of that the one virus called human papillomavirus that causes cervical cancer. And this virus infection causes because of the low immunity and exposure to the infections, because Indian women, and this is because of the fact that the early age marriage which was prevalent in India. But because of the social changes, now we see that the marriage age has changed. Even in villages, the marriage age has changed to above 18 years. It is recommended, our research has recommended to the Indian government health ministry the regulations that the marriage should be below 18 years, because before that if marriage occurs they are susceptible for infections, and there are genital hygiene, then smoking, many other things, and their promiscuity, many other things which is now controlled through the media and newspaper and awareness and screening. That is one cancer which can visibly see through colposcope or visual inspection, and there are a lot of screening program, pap test is done, and because of that the cervical cancer has gone down, whereas breast cancer has increased tremendously. And because of our lifestyle change, our sexual behavior has changed, and that is how it has gone high. And oral cancer also, in spite of lot of awareness and all, and through media and TV, it has not decreased, because use of pan masala and all types of the smoking habits and alcohol, that has remained steady, and because of that oral cancer is increasing rather, and that is why these three cancer, while cervical cancer is little down, but all other cancers are increasing, but we are not very aware of this, the symptoms and all the factors or the risk factor that pre-exposes to these cancers. So, one should be aware of these factors, and this is the main reasons.
Thank you very much, Dr. Das. Next we have Dr. Mausami Suryavanshi. She is a MD PhD. She is a senior consultant at Rajiv Gandhi Cancer Institute, Delhi. She is an oncologist. She has a extensive clinical as well as research experience in cancer. So, Dr. Mausami, being as a clinician, how you see the common symptoms of cancer that general people can be made aware of?
Okay. Thank you, Dr. Dhruv, for giving me this question. And this is a very important question. I feel with the general public should know that how do you pick up that the symptoms of cancer. I think most of you are aware already that any mass, any lump, especially the females, and we have a lot of young females here, in the breast or any other organ which you feel and which is increasing in size, has to be seen with the eye of suspicion, and you must consult a doctor. And then there is weight loss. So, most of us also know that unsuspected weight loss of more than 5 kgs over a period of 3 months has to be taken with caution, and also sudden weight gain. So, there could be, which is most of the people don't know, is to be also taken with caution. Then there could be change in some mole which was already present on your body. So, if you have a mole and it suddenly starts getting darker or increasing in size, that has to be taken with caution. Then some bleeding tendencies, so bleeding per rectum from your excretion site, or vaginal bleeding, a sudden unexpected vaginal bleeding is also to be taken with caution, especially in the post-menopausal age group, has to be seen. So, and then some cough which does not heal with local medication, maybe 4 or 5 weeks, that has to be seen, or some other symptoms of fatigue or unwellness. You should consult a doctor when you face such problems.
Thank you, Dr. Mausami. Dr. Mausami, you have also working experience, and you are specialized in lung cancer. And if you see the global scenario of lung cancer, it's the topmost cancer in the world.
Yes.
And India, it's also coming up like second or third cancer after breast and oral cancer. So, what do you think, how lung cancer is increasing sporadically, and what are the possible treatment approach, the therapeutic approach that clinicians are applying to treat lung cancer patients?
Okay, good you raised the question about lung cancer. Lung cancer is one cancer which has changed drastically. If I give you example of when I was doing my MD, like maybe 20-25 years back, so that time we used to say that, okay, patient has lung cancer, within 6 months he's going to die. You give him anything, any sort of treatment. But today the things are absolutely different. So what has happened in lung cancer is, one, that we are having lot of non-smokers. So usually we have a notion that it is the smoking which is associated with lung cancer. Yes, there is a big chunk of smokers who have lung cancer. But now we also have people who are non-smokers and they are having lung cancer. So that is another scenario, and especially the women. So we have lot of women in India also, and in the Asian countries. The lung cancer spectrum is absolutely different in the Asian countries compared to the Western world. So here we have lot of mutations which are EGFR, ALK, ROS mutations which are associated with non-lung cancer, and women especially associated with pollution or the home cooking smoke. So that is one big factor which has caused increase in the lung cancer. Then coming to the treatment part. The treatment is, right now what we know of cancer is there are two main modalities. One is the surgical modality, other is the chemotherapy modality. So these are the conventional treatments what we have. Surgical treatments are usually offered in patients who are low grade, right, stage 1 or 2, stage 2, they are usually offered surgical treatment, and then you can go to chemotherapy. But what has changed now, especially in lung cancer, because it is leading the bandwagon of new therapies, that you have molecular therapy or the precision medicine as well as immunotherapy. So molecular therapy means, so instead of chemotherapy, which works on the principle of kill all the cells, you are targeting just the mutation which is driving the growth of the cancer and killing it. So these molecular therapies are in the form of tablets. So these are not like chemotherapy, your hair don't go off and you don't get those kind of infections. You just pop in the tablets on the daily basis, and there is a miraculous, I must use the word miraculous, is there a miraculous reduction in the bulk of the tumor, the quality of life. You can keep on doing your daily work which you are doing, just taking the treatment for cancer. So these are what I am talking about, stage 4 patients. Then there is immunotherapy which has come especially in lung cancer, where you use the immune system of the body to kill the cancer. So these cancers are killed just by using your own immune system. So these, and at times the tumor absolutely disappears. So that is also happening, though this is a very small chunk of patients, but this does happen.
Great, Dr. Mosmi, as you have mentioned, immunotherapy, targeted therapy. So now people are talking about combinatorial therapy and precision medicine. So could you please tell about how this combinatorial therapy and precision medicine works against cancer?
So the precision medicine is basically, it is like you go, once we are used to going to shops, we go and buy a shirt. Okay, so precision is like I get a shirt which is tailored to my own size. I'm just not buying one shirt. So here, every tumor which apparently is a lung cancer, you go and do a molecular diagnosis and find out which mutations this particular tumor has, and then give a drug based on that. So this is precision medicine, this is called targeted therapy, and this is individualized. You can't generalize that all patients of lung cancer will not have the same treatment. So everybody will have a different treatment based on their molecular profile. And then coming to the combination therapy. So you can combine the therapies like the molecular therapy, where you are targeting the mutations, as well as you can combine the immunotherapy, or maybe you can combine chemotherapy and immunotherapy and then target the disease.
Yeah, what is the success rate of this combinatorial therapy or the precision medicine?
Okay, success rate is like if you have a patient who has a target, in that almost 70 to 80% of the patients respond to treatment. And respond, I mean you have to see the scans, the tumor just disappears. It's that kind of response. Okay, immunotherapy, right, 10 to 15% patients respond, but those who respond, they actually respond. So these were the patients who would have died. Like I told you, they would have just died within 6 months. So now the extension of life with quality of life, like maybe more than 5 years they survive, and if they keep on changing the therapy, they can do better and better.
Yeah, just continuation of your statement, I would like to ask Dr. Das. Dr. Das, you might have seen tumor heterogeneity, and there are lots of papers, the reports which are available that the same therapy, immunotherapy or combinatorial therapy or targeted therapy, it works for one person and it doesn't work for the other person. So what is this? What is called a heterogeneity, tumor heterogeneity, and how we can deal with this kind of problem?
Yeah, this very complicated questions or important questions, rather important but complicated, because one has to study the heterogeneity. It's a genetic heterogeneity or a mosaicism, or there are also heterogeneity from the point of view of the mutation, genetic mutation, alteration. That's what it's a continuous, it is the point raised by Dr. Mausami is same problem comes in. That's why it is needed for a personalized medicine, and there is a microenvironment also. It differs from person to person. No two individual is same. So you cannot have the same shot for everybody or same medicine for everybody. So there is a heterogeneity, that is, it may be genetic heterogeneity, it may be the cellular or the tumor heterogeneity. So and that contributed by the microenvironment changes, and there are a lot of molecular, now it is called molecular genotyping or molecular typing of the or classifications of the cancer, and that is mostly applicable in the like breast cancer. It is hormone related or disturbance in the hormone, but then there is a molecular typing has come. So now all this therapy in cancer therapy has gone molecular or immunotherapy. So immunotherapy also depends on the molecular. So you have to take care of that heterogeneity. That's why when the general the medical oncologist, they go for treatment, and if that is not like PGIMS or the AIMS or like postgraduate medical institutes where there are experts and the treatment and the genotyping is available, but in the general in this country all over it is not possible to do that level of genotyping and then to treat the patients. So it is developing and it is now being understood, and I hope in future time this will be taken care of.
Great. So to provide a proper treatment, first we need to genetically screen the patients to identify the proper mutation, then we can go ahead for the treatment. Great. Thank you very much, Dr. Das. Now we have Dr. Subrajit Biswas. Dr. Biswas is a professor at Amity Institute of Molecular Medicine and Stem Cell Research at Amity University, Uttar Pradesh, Noida. Dr. Biswas has more than 20 years of research experience in liver cancer. He has published several research journals, including Hepatology, that's topmost research journal in liver cancer, Blood, and other like a JVC, and many more. So, Dr. Biswas, you have huge experience in liver cancer, and if you see, liver cancer is like one of the topmost cancer, I can say it's a growing cancer in India and globally as well. So, could you please tell us the current scenario of liver cancer in India, and what are the important approaches that can be considered for the treatment or management of this disease?
Right. Thank you, Dr. Dhruv, to emphasize these important questions regarding the liver cancer, and I am working vigorously on liver cancer. First of all, liver cancer is called the hepatocellular carcinoma. So, liver is made up of the hepatocyte, is a 70-80% populations in the hepatocyte. If there is a mutation on the